Hi everyone, I want to teach you guys a really great method to loosen up the chest muscles for those of you that suffer from costochondritis. So we've never done a video on this, so we're going to have you stand up and turn around and face the other way. So we just did this on his upper back. He has scoliosis, John, and costochondritis, and he's got a heavy labor job, so it tends to flare up a lot for him. And then the underlying issue here is he has scoliosis, a left scoliosis, not a severe one, but it's enough to throw everything off. So turn back around for me. Today, right, you had this injection? So he had a steroid injection today to reduce the inflammation, and that's great to get him back to work, but it's not going to fix the issue. So while this is a common treatment for costochondritis, and really the only treatment other than maybe an oral non-steroidal anti-inflammatory, it's going to help him get through it. It's going to reduce the pain. So we're not going to laser over that site. But what I did was I loosened all the muscles where the rib heads are, over the rib heads. That's where the cupping was done on his back. We did it with movement, active range of motion. So we're going to do the same thing here. We're going to do it on the chest. It's this side that's worse, correct? Do you have any pain on this, on the left side? No? Just the right side? Okay. So we're going to just put a little bit of emollient or lotion. You could use any kind of lotion. I like China gel, or this is something a little different, but this is not my favorite product. China gel, we're out of it. We're waiting for some to get shipped in. That's pretty good. And I'm going to show you guys something you can buy online. You can go on Amazon. The wait list, it's going to take a while to get to you. So if you live in like a city, like San Francisco, New York, where there's a Chinatown, I don't know if there's a Chinatown in Chicago or not, but go to the Chinatown. You can buy a set of these. These are cups. And some of them even have tubes that come with it. And the tube, you plug in the tube in, and you can actually pump up the cup and attach it to your back where you can't normally reach. So that's nice if it comes with a tube. This particular set right here does not come with a tube, but I don't need to do this to myself. I don't need a tube for this. But if you're doing this and you don't have anybody else at home to help you, this is a great solution. And then it also comes with a set of like 15 cups and then this pump here. These pumps after a while do go, but the set's only about 25 to 30 bucks. Some are even cheaper if you get like a 10 or a 12 cup set. So again, you can buy them on Amazon. We'll leave a link for you there. And then also there's only one company that makes curved cups. So on the ends here, the cupping is curved. And that's really good to put it like on the corner of a shoulder or an area that's got curves to it, like up here on the top of the shoulder. Otherwise, you have to use a smaller cup, which works. But if you want to get a big surface area, use a big cup, you need those bent or curved cups. And you could see what I mean here. This surface here is flat, so the curved ones have an indent in them. All right, so here's what we're going to do. I'm going to put one cup right here, and you only need to do about 2 to 3 pumps. So this is the first time we're doing this on him, on this muscle here. So we're just going to do 2 pumps here, and his tends to be higher up, not as low down here, right? The pain. Yeah. Going to take the other one, put it right out here. Good. Okay, now what I want you to do is I want you to reach your arm across. Yep. And then bring it back. Slow though, right? So you're going to reach. Yep. And then bring it back slow. Okay. And then reach forward. Keep your shoulders square. Yep. Good. And then reach back. Okay, so we're actively taking through some range of motion here. And what cupping does is it helps get more blood flow to that area by lifting the tissues. And we heated up the tissue first. So we gave him a lot of moist heat for about 15 minutes in the mid-back and that helps. And this just helps get the, reduce the viscosity between the interstitial layers around the muscles and the tissue. And there's nerve endings that go through there. So there we go. And relax your arm and drop it down. So you notice this one's more purple. We had this one on for a little bit longer. Now we're going to go ahead and do another spot. And a lot of you have seen us do cupping before where we just have the patient stay still. This is just a different technique here. And same thing here. Okay, and you're going to do the same thing. You're going to reach across. That one's hard. Okay, and this one I did 3 pumps. So the other cups I had up here, I did 2 pumps. This one, do you want me to loosen it up a little? Is it too much? Okay. That's good? Okay. So you can just pull the pin right here real quick or flick it, and it'll release a little bit of air, make it more comfortable for the patient. Again, these are things you can do at home. Don't leave it on long. You just need to leave it on 2 minutes max while you're going through motion. And I'll show you what we did with his back, the motion we did with his back. Okay, good. And then bring that arm back and then up and down a little bit. So we kind of have it on the pec minor. So that pec minor brings the shoulders forward and down. So that's why I'm having him bring the arm down a little bit and then up here, stretch it, bring it up. Yep, and again. Good. Okay. And then go ahead and lay on your stomach, and we're going to go through the motion that we did. I'll have you do the child pose, okay? So what we did was we put 4 cups here, and you can see they're really purple. We just did this a few minutes ago, and we had him go into the child pose, and then, you know, go left and right, and you could see those cups, those marks right here, and then go ahead into child pose. So he had the cups on him. Again, I put some lotion on the skin. He had the cups on him. Go ahead into child pose. While the cups were on, then we had him stretch a little bit to one side to the left. Again, all while the cups were on. This takes about 90 seconds to 2 minutes tops. Really effective. And I would wait about 2 days if you're going to do cupping again over the area. So next time we can go in between where his other cups were, but I'm going to wait at least 2 days to do another cupping session. If you guys have any questions about cupping, feel free to ask or comment below. But basically, cupping is going to open up the interstitial tissues, break up that viscosity, get them gliding better. And when those tissues are gliding better, our range of motion increases, and it's going to reduce his risk of injury. And cupping has other effects, physiological effects, but it also has a lot of contraindications. And I want to put some of those contraindications up here on the screen so you guys can see those contraindications. So you don't go out and buy a set of cups and you find out that you're not a good candidate for it. So these are the contraindications. Again, if you have any questions, don't forget to comment below, and we'll see you soon. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like, and don't forget to subscribe. Appreciate you guys.